Thank you for listening to Room 9, my daddy's podcast. Hope you enjoy. If you would like to help Room 9, please visit their support page. You can listen to Room 9 on your favorite podcast listening platform. Don't forget to visit our Instagram and Facebook page. Please like it. Room 9. If you better yourself, you better the world.
Hey, everybody. Man, we are just pumping out episodes like crazy. This is what a social distancing period does to you. Although I will say I've not been great, and I think you regular listeners know why I don't like doing remote podcasts. It's a big trade-off. I can get a lot of different guests on, some really cool guests from all across the world, but I can't stand the sound quality. I'm just too anal about sound quality, and it drives me nuts. But here's another episode. In this episode, I have a repeat guest who was almost on exactly a year ago. And this is the Vice President of Residential Treatment at Horizon Health Services, Brandy Vandermark-Murray. And we have a great conversation on how Horizon Health has just adapted and evolved over this period of time of getting telehealth out there and making sure everybody's safe and getting all the equipment they need and everything else that is necessary for a place like this to be able to continue providing the very important services they need to provide for a community. You guys will enjoy this, and it just kind of lets people know how these companies have been kind of changing up and going with the flow. So that is all I got for you. All links are below for Horizon Health Services and all that other jazz. And be ready and be prepared for more and amazing Room 9 episodes. Okay, I love you guys. As always, be encouraged, stay strong, and speak up when you're struggling. All right, peace.
Because we've done a previous podcast on residential.
Yes, we did. I was just looking that up because I was like, when did we do that? And that was May 20th last year. So just over a year ago was when we first sat down.
Yeah.
So it was a good time. And then I've done one with Jeremy. Is he still there?
Mm-hmm. He is. Yep, he's still the director. Yeah.
How's he doing? How's our things going there?
Good. Busy as usual. But no, I mean, it's interesting this time because we're screening for COVID while we're bringing people in. So it's a heightened level of anxiety that was already there.
Oh my gosh. Yes, I know. A lot of people are kind of getting all out of sorts and kind of struggling with what to do. And now you have all this protest stuff going on.
Yeah.
And things are a little intense.
They are. It's been a rough 2020.
Yeah, which is funny because I was just talking with Christine, my girlfriend, the other day, and I'm like, this has been a great 2020 for me. I've already made more money with my company than I have all of last year. And, things are just kind of looking up for me. It's just totally different when you don't turn on the news and constantly watch it. Cause I'm like, I didn't even know at first. She was like, I got a text from her and she was like, wow, things are getting crazy when they put that first curfew on.
Yeah.
And I'm like, what do you mean there's a curfew because of protests for COVID and wanting to get the economy? She's like, no, for this George Floyd. And I'm like, I didn't even know there's protests going on for this. So that's how out of the loop I am when it comes to the news and everything else.
Well, it's hard. I mean, not everything's all bad. It's just the things that have happened have been so big. It's hard to not have it be part of your thought process day to day.
It is. Yeah. Yeah. It's been pretty intense. I know my mom was having some anxiety over it.
Yeah. A lot of people are for sure.
Yeah. Have you seen now kind of there as far as like Terrace House and everywhere else, have the residents and the clients, have they kind of been affected by it? Obviously, I know the COVID thing, but everything else, have you seen heightened anxiety a lot?
I think that I wouldn't say heightened. I think that there is definitely feeling in the air of sadness. And I don't know what the word I'm looking for is other than sadness, because I think people are really, trying the best they can. And it just keeps happening. And so it doesn't matter if it happened again. It's just this, nothing's going to change. And I don't know, the past few days, the patients, I think, have been just having some honest conversations, which I always encourage. And staff have been having some honest conversations, which we always encourage. And I think that's a good start. But most of the patients we serve have a pretty high baseline of anxiety and depression. And so I don't want to say it's more or less. I think it's something that they always kind of have. But all the conversations I've had in the past 48 hours, I will say, have been respectful and hopeful and in a positive direction.
Yeah, I guess you have to kind of keep that hope there, or else it is frustrating, though. I mean, I feel like history is constantly repeating. I mean, even with the COVID thing, I remember it was actually probably a few weeks before it all started. I was watching this, I think the documentary series is called Pandemic on Netflix.
Oh, yeah. I couldn't finish it.
Yeah,
it was too much for me.
Yeah, and people go around the world and have been trying to warn people of stuff like this, and we just ignore it. And same thing with like the environment. And we always end up, instead of preparing and holding things off, we just want to react to when something happens. And it's like eventually that's going to really, really screw us all over.
Yeah, no, I agree.
Things are intense, things are crazy, but how is everything holding up with Horizons and with all your inpatients, outpatients?
Yeah, sure. Well, I think in residential in particular, I will tell you in March, when things kind of first started to happen, there was so much unknown. And so with all that unknown, for us in particular, we were serving a large population. And, some of our programs were more contained. We didn't have a ton of people coming in and out. And other programs like detox and inpatient, we do have people coming in and out because they're seeking treatment every day. So in March early on, I think that there was a lot of, what do we do? How do we make sure we keep serving our population safely from a COVID perspective and then from an addiction and mental health perspective. So in residential, we did make changes. We slowed things down quite a bit for a few weeks, with the front door, making space for our patients to not necessarily be right on top of each other, doing groups, getting things like PPE, like I know there's a lot of attention on hospitals, as there should be, they're the frontline workers, but even like us working with patients who are, coming in off the street and might have symptoms. And so just getting all those things prepared took some time, but we have a really strong management team and we have a really strong executive team. And so we were really organized and thoughtful, and we really just moved quickly to make sure we could do things as safe as we possibly can. So for a period, I did slow things down, and then we kind of learned. We learned like what the symptoms were. We learned how to get tested. Could you get tested? What did quarantine mean? What did isolation mean? We learned all these things. And we put systems in place to be more prepared. And then we started saying, what? Encouraging people to come back in and to seek out treatment, because I think for a while, mostly in April, people, and still now in May and June, they're scared to be around other people sometimes because there's this fear of getting sick. And so what we saw was people were a little bit more hesitant to come into a residential inpatient detox facility, just like you saw in our community. People weren't going to the ERs for medical conditions because there was fear. So while we kind of slowed down the spread, which was our goal, we also saw that the patients that were coming in, their symptoms were so much more severe. And part of it was because they were isolating, they were home alone, they weren't seeking out the supports, they weren't around people who maybe would call them out or, intervene a little bit quicker. They also were anxious and depressed. And so their coping skill of using increased. And so all those things combined, the people coming in just felt more severe in their addiction process. So that kind of started to occur. And then probably through May, you started seeing people reach out a little bit more in coming in. And in the door, I see people coming in a little bit more over the past few weeks. And so we still try to do things as safe as we possibly can. We're screening patients, upon intake. We're screening symptoms, minimally twice a day, temperatures and respiratory symptoms, and still practicing social distancing. All of our staff wear PPE if they're by patients, and patients are required to wear masks if they're around other patients now. That's really an interesting kind of experience, but like we're teaching them also universal safety and precautions for their overall health. It's not just about addiction. And so the patients have been incredible though coming in. They're very grateful for the services, as they usually are anyway. But now with that isolation and stuff and being able to get that support, and they appreciate the safety measures, even though they're frustrating. I mean, no one loves wearing a mask, but
No,
at the end of the day, like they've been pretty respectful. It took a little bit of behavior modification and things like that, but They're doing well. Our outpatient is interesting because, we went really quickly to telehealth and telephonic support. And so accessibility for those who are struggling was actually increased through this. There was no barriers of transportation, no barriers sometimes of scheduling or childcare. And so we saw an increase of people utilizing the telephonic and the telehealth services, and which is great. We want people to reach out and experience that support. And then but we still see incidents happening in the community more so, and it is sometimes hard to engage patients as much if they're really, really struggling. So we're trying to figure out that balance of like how we do really great quality telehealth work, and patients, are they reaching out for support and things like that in their community with limited resources right now, right? So even things like self-help meetings, most of those are virtual, and for a lot of our patients, that's a huge support for them. Church, right? Huge
Mm-hmm.
support for people. So we're really trying to make sure that we're using the virtual model as much as we can, but people miss connection and they miss people, and that we can't duplicate. We're just trying to figure out the best we can right now and maintain safety. So that's kind of what's going on with Horizon right now. We're, using this as an opportunity to be more innovative, but really make sure we're reaching the patients and providing quality care through different modalities.
Yeah, I think it's definitely adjustment, missing that person to person connection for
Yeah.
sure. Have you found, because I've talked to several different people, have you found at all that, I don't know if you've heard from people, that you've had more people opening up and being more vulnerable through telehealth?
So it's interesting. I have patients so in residential treatment, they're doing groups still in person,
Mm-hmm.
right? And so they get an opportunity to still be with their community, just 6 feet apart kind of thing. But we do have patients who are linked with mental health services or, different groups. And I have had a couple patients who have said that they felt, especially if they have a lot of anxiety, that they were able to open up a little bit more because they didn't feel people looking at them, right, in the
Mm-hmm.
group, or they felt like there was really no kind of risk of speaking up. And so I've heard the pros and cons for sure. And that's very individualized. We have people who have reported, for example, and this is patient report, because we did say, like, what are some of the, silver linings of this? We're
Mm-hmm.
trying to also look at those opportunities. And I did have a few patients who said, so in residential, we don't do any family visitations anymore, because part of reducing risk for COVID is to limit foot traffic. You don't want as many people coming in, and you don't want people having more exposure. And that was a really difficult decision. But we made that in March. And so we've gone months where people haven't had in-person visits with their family members, and we offered family programming. And so a lot of our patients, we have said you can use your phones. We gave more access to personal cell phone use for FaceTiming, for using phone. And a few patients said, my relationship has improved because I'm having more conversation. I'm forced to have a conversation now versus filling my visit with maybe going and watching a movie or going shopping and kind of keeping busy. And so that downtime has allowed people a moment of pause. And with children home now from school, like, people are home when you call, right?
Yep.
So I had a couple people said, my relationships have really improved because I have opportunity to have meaningful conversations. That doesn't necessarily replace that they miss the fact that they want to physically be with their loved ones. But when people are in recovery, communication is one of the skills we tried to build. So this is really forcing people to practice it.
Yeah, it's totally kind of forcing you to keep that conversation going, because it gets awkward pretty quickly on a phone with
Yeah.
somebody and there's silence.
And people are asking more questions. I mean, I don't know about you, Sean, but people in my personal life too have said more things like, how are you? Like, how do you feel? Like, people are
Mm-hmm.
asking questions with like more intention as opposed to what are you doing? Right? Because that seems like it could have been a question that was more popular, where now no one's really doing anything. And so the question is, how are you? Which is different.
Mm-hmm. Yeah, that's completely different. Unfortunately, I don't have a personal life, so I haven't had too many of those calls, but
Yeah. Well, and the thing is it's not even the calls sometimes. It's the text messages that you get sometimes,
yeah.
just how are you? Or, a simple I'm thinking of you. Like, it felt like those increased. And I hope that continues with some of our patients and our staff, just that level of empathy that, like, we all are going through this challenge together. So in residential treatment, the patients are going through this together. And that does have a level of connection that they're like, they feel safe, they feel connected. Yeah, it's hard, but that empathy definitely has been impacted.
Yeah, I feel like that would bring a group of people together for sure.
Yeah.
Have you had to separate anybody in rooms? I mean, I know it's always kind of been two to a room anyway.
We usually, well, it depends, right? Certain programs, we reduced our census to make space. But what we did is we went through our rooms to make sure that, like, for example, minimally was 6 feet apart sleeping space.
Mm-hmm.
And it is, so that was good. But we did designate certain rooms in our facilities as isolation rooms, which are completely empty. And they're used for someone were to potentially have symptoms, right? So if someone were to get a fever, we would put them in this isolation room and monitor them and things like that. So we are required to do that. That was something that kind of came out early on, and we did that, and that was a challenge for us. I'm not going to lie, because we were a full capacity facility, and now we have to come up with space to put people in potentially. So we've accommodated that, and we do that. We do more groups. So for example, we had to make the groups smaller. So as opposed to 2 or 3 groups running at the time, we might have more because we're spreading them out and doing things like that. With the weather being nicer, you know what the campus looks like. We have outdoor space. So we're encouraging people to do things outside, have group outside, do your counseling session outside if you want to. There's nothing that prevents us from doing stuff like that. So we're fortunate at Horizon Village because we have that space, which people sometimes love and some people hate. But for this circumstance, that space really has helped us. They can still go to the gym. They can still go play volleyball. They can do all those things. They're not literally in a building the whole entire time.
Yeah, I was very, very thankful I was there during the warm season.
Yeah.
As much as I was annoyed I missed my summer, I was very thankful I could go outside and play guitar and be
Mhm.
alone. I enjoy being alone. Yeah, I can imagine it's been a huge adjustment for you guys. And how have like your employees and the counselors and everybody, how have they adjusted? Are they working more? Are they working less?
Well, I think it's twofold. So in residential, we're all essential workers,
Hmm.
healthcare workers, right? But when I say essential, like we didn't have the option to go remote, right? Our patients are still in the building, so we go to work. So the first few weeks, along with the rest of the community, I think everyone was just trying to assess like what was real, what was not, how contagious is this, how do I get it? Like everyone was it was information overload. Like
Hmm.
you really didn't know what to do. So there was a lot of questions. And so strategically, what we did is we really increased our communication to our employees. We had increased communication through, corporate calls, emails, check-ins. It was so much talking and planning and making sure people were on the same page. A lot of our staff were grateful to come to work because that sense of normalcy helped them kind of get
It's
outside
important.
of what was going on in the rest of the world. And even though there is the risk, anytime you're kind of around people, we also learned ways to reduce risk. And so we kind of kept saying, like, if you are practicing things like wearing masks and washing hands and social distancing, like the risk significantly reduced. So our staff went through that normal level of like anxiety to, okay, I'm good. And now I don't want to say it's business as usual. It's different, but we know what we can do to keep ourselves as safe as we possibly can. What we did see is we saw, increases in overdose and we saw increases in deaths in Erie County. And so for a lot of our staff, there was a level of sadness and anxiety around not serving as many people as we possibly could because you saw that happening too.
Hmm.
Right. So people were avoiding coming into treatment maybe because of COVID, but their addiction was taking them to a dark place. And unfortunately, we lost a lot of community members. And so our whole mission is to help people, right? And so we need to make sure we're here and we're present to do that. And so anyone that comes in is an opportunity for us to help someone save their life. So my staff has been incredible. And they talk just like when we're talking about like transparency and stuff like that. So you check in with your colleagues, you take some time off when you need it, you laugh, you do those things you can do, but they're good. They're really good. And I figure like healthcare workers in general, they kind of run into the fire, right? Like
Yep.
that's
Yep.
kind of what we do. An addiction treatment specialist, in the addiction world and mental health world, I feel like it's very similar. Like the crisis is something that we're used to. This just was a little bit more personal probably for some people.
Yeah, I've had several people. I've had one buddy who kind of really had a big slip up for a couple weeks and he kind of got back on track, but I've had several people call me and they're really struggling just because their whole routine of working and going to the gym was all cut off and their whole life was changed. So there's been a lot of adjustment. And I have yet heard those. I think it's been Erie County, Chautauqua, Wyoming County. They're all kind of sprung up over the last few
Hmm.
months since this has all happened. And so as far as like you're dealing with a lot of your people who are, I guess, say outpatient, have you had to how are you guys doing groups? Is that all kind of over Zoom? Have you seen an increase of like kind of anxiety go up with that?
Yeah, I would say symptomology across the board for mental health and addiction has gone up for most of our patients. We are doing virtual groups. We have started that up in using, I think, a Zoom platform and some different methods. We have done a lot more telephonic and telehealth type stuff.
Mm-hmm.
We are scripting things like medications, and those things are still being delivered to people, and psych visits are still happening virtually, and recovery coaches are still reaching out to patients telephonic and virtually. We're scripting things like naloxone to get them to patients, and we'll have the pharmacies deliver them. So we're trying to use as much as we can as possible. But I would say, across the board, patients have been pretty candid about how much they're struggling. That doesn't mean that just because they're candid that it's going to stop it.
Yeah.
Right. And so we know that there's been an increase in incidents. And the other thing across the state that has happened in the past few weeks is we've seen an increase in overdoses related to cocaine as well. And I know that last week we lost 3 people in the community, I believe in North Tonawanda, related to cocaine overdoses
Mm-hmm.
laced with probably things like fentanyl. And so we see that happening not just in Western New York, but definitely throughout the state, and people talk about it. And so we keep advocating and making sure that people realize that hopefully COVID, we get a vaccination, and hopefully we see change and all that. But we still have this crisis of addiction and mental health that was here before COVID. It's being exacerbated during this time. And we have to be here to be able to help people when they're ready to reach out, because I do fear that it's going to be way worse in the next few months than it was maybe 3 months ago.
Yeah, I think with the fentanyl, things are getting crazy, and it can just it always like I was laughing because my mom was asking me the other day when I was over about it, and I'm like, it makes no sense to put a downer in an upper, and it's just super bizarre. And sometimes my mind wonders, like, it's almost like people are intentionally trying to kill people.
Yeah, or
Eh,
intentionally trying to get people more addicted. I don't
yeah.
know. It's interesting because it's not, like I said, localized to Western New York.
Mm-hmm.
I know the Capital District had a significant increase in those as well. But the danger is definitely out there. And that's the concern, is that we have people who are more vulnerable because they're struggling, and they may not even realize what they're taking.
Yeah, it's crazy. It is definitely really Russian roulette every time you are stepping out and into that world. Have you guys have you closed down a lot of your buildings?
We do have staff who are working in our buildings. And so while patients maybe aren't coming on site, we still have staff that are supportive type
reporting.
staff that are going to be present because, they're getting records ready, or, taking phone calls, and patients are still calling. We are doing in some locations, IMs for medications. Like, those services still have to continue. But most of our staff and outpatient, because they can work remotely, we've done our part in trying to make sure we're keeping our community safe with having people just stay home if they're
Mhm.
capable of doing that. And unfortunately, we have a lot of things we can do that way. And so our facilities are open, but most of them are not taking patients.
Nobody's really kind of coming in.
Yeah.
And have you seen a lot of people who, I mean, this is not something I really thought of up until, my mom's a teacher, my girlfriend's a teacher, my sister's a teacher, and they all talked about the whole distance learning and how so many people actually literally don't have access to the internet.
Yeah.
As shocking as that is. Have
Mhm.
you seen a lot of people who maybe don't have phones? How have you adjusted to that?
Yeah, no, my husband's a teacher, and he teaches every day from our basement. So I know how challenging it's been to do remote learning for the teachers and for the students. But
Mhm.
we actually did a survey with our patients. So the executive order allowed us to do telephonic and telehealth. And so previous to COVID, you never could bill or do telephonic services clinically. And so that changed with an executive order, right? And so we did a survey recently, and I actually just saw the results this week. And so it really was about, I think, around like 18% that didn't have access to those things, such as a cell phone or Wi-Fi. So it's not as large as one may think, but it still
Mhm.
is definitely a population that we need to be mindful of and make sure we're trying to engage in different ways, because there's probably other social determinants that they have going on if they don't have those things as well. I've seen in the community, there's been a lot of community organizations and members who have done like Wi-Fi hotspots or free Wi-Fi, and the city of Buffalo has put out more Wi-Fi and things like that. But we do have to make sure we're engaging those patients that don't have those resources.
Yeah, I know. It's crazy to think sometimes in 2020 there's still people who don't have that, but it's definitely a reality
Mhm.
that, I mean, a lot of us, I guess, me, I realized how much I take for granted when I kind of heard that from people,
Yeah.
because there's a lot of people who really don't have that access. And
Well, it's not even just access to Wi-Fi and phone. It's also like equipment and other things like that. So, not everyone has, for example, like a laptop or a computer, and so looking at stuff like that. But for the most part, a large portion of our population did, but it was about like right around there, 18%.
Did you guys have to like supply any of your employees to work from home with
We did,
computers and
yeah.
tablets?
We did. Like I said, we had a really organized management team and an executive team that we were already kind of trying telehealth before COVID. We were, going into that kind of model of offering another modality to engage people and provide resources. So we were already kind of in the midst of transitioning a little bit of that. And then when it happened, it was kind of like you just prepare for it. This week happens and you get everything going and everyone has their to-do list. And our staff were deployed with either materials, if they had material. Some people had them and we took surveys to see what people needed. So yeah, we were really fortunate that we were able to get the resources out to our staff to make a really smooth transition. And it took probably like a week or two. But, for the most part, everyone has what they need. And we do have some staff who are able to come into the clinics and use the materials and stuff that we have inside the clinic to still do their remote work.
Yep, good deal. I know it's been awesome to see all of you guys, Horizons, and I've talked with Spectrum and, Evergreen, and just how you guys have all totally adjusted and are still there to support the community, because I know it hasn't been easy for a lot of people, and obviously this is a huge necessity for even more so than it was, back in the beginning of March, because people are really, really struggling to be alone. I mean, so many people are completely alone. And I think, we're not used to that.
Well, even people who I think maybe didn't identify as having a mental health disorder or identify as having a substance use disorder are realizing that, when we are challenged to the degrees that we've been challenged, that I have, people who are becoming depressed or have more anxiety who are like, I never had to experience this level of symptoms. And so we do have people who are reaching out who maybe traditionally never even thought of themselves as having a mental health disorder, because there is acute symptomology. You can be, a situation can cause you a lot of duress. And I think a lot of people during this time are experiencing that. And so I do encourage people, even if you're thinking, well, I'm not really sure if I'm depressed, there's no harm in getting an assessment or at least talking to someone and working through some things.
Yeah, and I feel like if if you have to say, I don't think I'm depressed,
yeah,
it's probably worth going and talking with somebody.
Yeah. And people don't realize the benefits of taking some time for yourself, or, just having that opportunity to take away the stigma of asking for help, and people, if they reaching out on the phone right now, let's say you're like, okay, well, I don't have time for that, or, I don't have this for that. Like now you literally, it's the easiest possibility. You can just call someone and make an appointment today and talk to someone on the phone.
Yeah.
It's never been easier.
Which is great. Yeah, that's awesome to have. In like the beginning of all this, did you guys have trouble getting the masks and all the protective gear that you needed? Because I know a lot of people have had to get over that challenge.
It wasn't super easy. And I will tell you, in residential, it was a priority for us because we knew if we were going to remain open and work with patients, we had to protect our staff and we had to be able to protect our patients. And so we really hustled and worked with our counties, Niagara County and Erie County. We worked with suppliers. It took a lot of research and manpower to try to get some things. And there are some things that are still not easy to get, such as like gowns, but over the past, unfortunately, I want to say 2 months, it's gotten easier, but the first few weeks it felt like you were trying to just get bottled water for like a hurricane. Like you were like, I don't know where to get a mask. But we all felt that. I mean, if you remember the first few days, like looking on Amazon to try to buy a mask or hand sanitizer,
It was crazy.
It was crazy, right? And so we were proactive. We've been fortunate that we've been able to stay ahead. But here's the other thing is that we don't know how long this is going to go on. And so we just keep putting it into our inventory and reaching out to the people in the community that can help us. But it wasn't easy for sure.
No, I don't think it was easy, like you said, for anybody, even at home, trying to order some stuff off Amazon has been pretty intense.
I haven't seen a Clorox wipe in 2 months at the grocery store. So, and I don't want to be a hoarder, but I literally haven't even seen them. So
yeah, it's so funny. I didn't get the toilet paper thing at all, but
yeah,
I'm not sure what that was all about. But yeah, I don't even know what to say about that. That made me scratch my head a lot. What are some of the kind of end this and push us towards, obviously it's all been positive, but a very good positive note. What are like some of the big things that you have seen that have been awesome, whether it's the way people have changed and how people have stepped up? What is it that you've seen that we can kind of end with a positive note?
I think that the positive is that if we can keep the conversation about the importance of mental health awareness and addiction awareness. So while the numbers have gone up and that's not positive, there are more people just acknowledging mental health and addiction. They're just talking about it a little bit more. And I think people are aware a little bit more about the importance of community. So while we miss our neighbors and our family and our friends, for me and for the things I hear from some of my colleagues and family is that there's an appreciation for the people around you, more so probably than a few months ago because you just weren't as present. So that for me is probably the positive. And personally, I'm very grateful that I continue to be able to work and serve this population. And, I think that it's important to get more resources as we move forward, but I'm grateful every day that we have the opportunity to keep helping the patients that are coming in and reaching out for support.
I really hope that as a community, as a country, whatever, even as like a whole world, I really hope we can kind of all come out with a better appreciation and a greater appreciation for community and people. Because I think we tend to forget a lot how, much we are social creatures and need that contact and that time with other people. I think we end up really missing that connection.
Yeah.
That is definitely, I think, one of the biggest things everybody is struggling with in general. And I think when you said that's so important too, is people talking about it more when it comes to mental health and when it comes to substance use, that people are just talking about it. I Googled it the other day, the number one way to end stigma. And you go down Google and look at every website, and almost on every list, number one is just talk about it. Just talk about it, just speak up, and kind of brought me to where I want to go with even Room 9 and the company is to really create a channel where people can tell their stories and how they overcame what they were struggling with. And I'm happy. I don't know if you know, I moved into some video production now, and I really want to start developing a community of that where people can all go and share their stories. And I think that is it. It seems so simple too. Just talk about what you're struggling with, talk about what you're going through. How did you overcome it? Where are you at? And yet so many of us struggle with it.
Yeah.
I don't know. I'm hoping really this kind of whole situation brings us all to that point where we are willing to talk about more what we're going through and struggling with. I don't know.
I agree.
Have you heard, have people been kind of like stepping up and being more open with everything, or is it kind of hit or miss? Yeah.
Yeah, I think that patients, I think when you come into treatment, you're all in different stages. So for some patients, they get to stages of being more open. I think going back to kind of what I said earlier, I think more patients are seeing someone next to them and asking, how are you? And really listening a little bit more. And that allows the person next to you to open up because, it takes a lot of courage to say, I need help. And it might take less courage if someone says, do you need help?
Yeah.
Right. And so I think I see more people kind of just checking in with each other, and doing those things. And that allows the opportunity for people to open up a little bit more in either groups or in one-on-one conversations, or, even just while there's not necessarily like hugging and things like that, but just saying, you know what, I heard what you said and thank you. Like simple things like that can go a long way for people to then open up more. I would say sometimes people struggle managing their emotions. And so in residential treatment, they're opening up more, but they're scared, they're angry, they're anxious, they're missing people. And so some of that comes out too. And so you have to be able to then tolerate differences a little bit more when people are frustrated. So I would say there's some conflict management that's definitely happening, which can be healthy. And so all of that is good work when you're working on communication and coping skills. You don't have to just be talking about your feelings. You have to be talking about what's really going on in your life. And that brings up some stuff. That was a long-winded answer for you.
No, that was great. And I think you really hit it on the head when you mentioned a little bit ago how not what are you doing, how are you doing? And I think that says a lot for the power of language and how that can really make somebody feel comfortable as opposed to just like a dry, empty question. What are you doing? And it's so different. Like I emailed somebody about setting up some podcasts and I just said, I hope you're doing well. Hope everything's okay. And she was just grateful for that, as opposed
Mhm.
to I need this, I need that, and I think that can be something if we pay more attention to the language we use and
Mhm.
just switch that up, from how are you or what are you to how are you. And I
Yeah.
think that's a very important thing, very much. So, any kind of final thoughts here to wrap up, Brandy, that you want people to know? I know you guys are still accepting patients and
We are every
clients, and
day. We're open 7 days a week. My final thought for you always, Sean, is just make sure you reach out for help. Horizons is open and we're willing. And if for some reason, there's a barrier, I think now is the time that we can help you work through those barriers. And just remember, like as a community, like it's important for us to take care of each other. And Horizons has been part of our community for over 45 years. And, we really want to make sure we continue to make our community healthy.
Yeah, what always comes to my mind too is that Brene Brown TED Talks, when she talked about courage, and the Latin word and the root of it really means to tell your story with your whole heart, and to
Mhm.
be willing to sucker up and have the courage and bravery to say, hey, I'm struggling, hey, I struggled with this, I need help with that. And I mean, I found that's one of the biggest things I've learned throughout my recovery from my addiction was to get rid of my pride and just ask for some darn help.
Yeah.
Because it can be challenging. So, well, thank you very much for joining me, Brandy.
No, no problem.
So I will stay in touch with you. I will obviously stay in touch with Christina and
Yeah.
all that other jazz. So
No, I appreciate it. Thank you, Sean.
yeah, it's always a pleasure. It's kind of crazy. I was just, when I looked at the date, I was like, oh, we did our first podcast almost a year ago.
Yeah, we'll have to put it on the record for next year.
Absolutely. So,
So-
May and June. We'll have to remember that.
Sounds good.
All right, Brandy, take it easy. I'll talk to you later.
All right. Bye,
All
Sean.
right, bye.